Hello, this is Dr. Bob, Anthony, and Kason DeMaria with another half hour of health for you. And we have been so blessed to have so many people come to see us from Northern Ohio and contacts from around the world. And people are always asking us, what should they take for a particular condition or protocol or supplement? Well, today, what we're going to focus on are some of the items that we have used successfully, clinically proven over time to help various conditions that I know that so many of you are tired of suffering with. And the very first product that I have that we'll be speaking about is a product called Digestive. It's a probiotic. If any of you have taken any type of antibiotic over time, you need to recolonate your colon or the flora. So I would recommend taking at least 2 or 3 of these Digestive every day, maybe a bottle or 2 after you've had any type of antibiotic supplementation or course. There's a product called Cytozyme H. H stands for heart. We use neonatal glandular products that come from either lamb, pork, or bovine. And what we have found is individuals oftentimes will have dysfunction in their body. And the Cytozyme H is a glandular product that has RNA and DNA in it that is designed to support tissue. So this particular product is Cytozyme H. H stands for heart. You always take these products on an empty stomach. So if you have, for example, some swelling in your legs, high blood pressure, or a history of heart problems, your heart just needs support. It's kind of like, think of it as cellular or glandular therapy, giving your body the nutrients that it needs to help the overall health. The next product is Cytozyme Q30. Many of you are taking statin drugs. I know there are literally millions of you taking statin drugs every day. You might not know that one of the side effects or bad effects of statin medications, and I'm not telling you to go off your statin meds, by the way, is it depletes the body of CoQ enzymes and the nutrient that's very important to help support heart function. If you're taking a statin medication, you're going to want to take 2 or 3 of these every day. Cytozyme Pan. Cytozyme Pan stands for pancreas. Do you know the 3rd biggest killer in America today happens to be diabetes? And I know so many of you eat processed foods. Processed food take and stress the pancreas. Cytozyme Pan literally will help promote the restoration of pancreas tissue. If your fasting blood sugar is 100 or above, I would encourage you to take 2 or 3 Cytozyme Pan on a regular basis. We use fasting blood sugar serum analysis in our office. I'd also encourage you to have an HA1C. An HA1C is the blood sugar that's on a red blood cell. Really a good product, and you always want to use it on an empty stomach. The next product that we're going to be talking about today is Cytozyme SP. Cytozyme SP stands for Cytozyme Spleen. The spleen is a very important organ. It's like a large lymph node. It helps eliminate unwanted and unnecessary dead red blood cells. It's also a very important part of your immune system, very commonly deficient. What I have learned over time, and I have a Doctor of Natural Health degree, which is training in Chinese medicine, I know that different organs have association with emotions. And the spleen could have involvement with possibly having sorrow. So if you have a lot of sorrow and your immune system is down, Cytozyme Spleen may be the product for you. If you have a chronic red blood cell challenge, Cytozyme Spleen definitely could make an improvement in your overall body function. This is probably one of the most important products that we use. I know so many of you right now are tired. We have a blood test that we use called TSH. TSH tells me how your pituitary gland is doing. Because of stress today in the environment, our pH in our body tends to become acid. An acid pH takes minerals out of the body, especially manganese, and it also takes chromium and iron. When you lose minerals, one of the organs that are affected are glands, that are impacted a lot is the pituitary gland. So if you have a low thyroid gland, I would encourage you to have a thyroid profile done. And one of those tests would include a TSH. If your TSH is less than 2, I've had some patients have their TSH be like 0.003, and they're on Synthroid and they're on Armour Thyroid. Stress could be one of the main causes of low thyroid. This is probably one of the most popular nutrients that we use in our practice. Cytozyme Thigh is exactly what it stands for. Thigh is for thymus. Especially during the wintertime, chronic cough, colds, flu, you're run down. Your thymus gland's a part of your immune system. If your white blood count tends to be low, if it happens to be maybe in the area of 4 sometimes, and even 3, and you've done everything and they said there's nothing they can do for you, Cytozyme Thigh, which is thymus tissue, is very important for restoration and improvement, once again, of your immune system. Always take on an empty stomach. Cytozyme B, you think, oh my gosh, that happens to be a B vitamin. No, it's Cytozyme B is for brain. We talked about Cytozyme PT. Well, Cytozyme B is for the pineal gland, the pituitary gland, the hypothalamus. I mentioned people are tired and fatigued. I would have to tell you that's probably one of the biggest epidemics that I've been seeing since I've been practicing since 1978. Fatigue. You're tired, you're exhausted, cold hands, cold feet. You just don't know what to do. What's very fascinating in our practice, and we do cutting-edge research, biocommunication. If you're watching us anywhere in the world, or you're watching us in our office right now, or even if you're a part of our TV family here in Northern Ohio, we do biocommunication. We can do a galvanic skin response, and one of the most common challenges that we see is low-functioning brain with the hypothalamus and pituitary gland depleted. We actually just had an individual come into our office that was suffering with bulimia and anorexia, and I know her brain was totally exhausted. We also see this with dementia, and we also see it with Alzheimer's. Cytozyme AD is for adrenal gland function. Did you wake up tired this morning? Do you have a problem with bright light bothering your eyes? Do you crave salt? Do you just have fatigue constantly? Does your back go out easy? Those are common body signals of adrenal fatigue or adrenal exhaustion. Cytozyme AD is very helpful for all of those of you right now that have low blood pressure and you don't know what to do. I've had patients have to take up to 6 of these every day. We might have to do saliva testing, an adrenal stress index. Oftentimes we'll analyze your blood potassium and sodium levels. That'll tell me how your adrenal gland is functioning. But right now, in the comfort of your own home, you could take your blood pressure sitting and then standing. If your blood pressure drops 10 or 15 points from a sit to a stand position, Cytozyme AD could be the answer for you. And if bright light bothers your eyes, yes, once again, Cytozyme AD, I'd like you to look in the mirror and look at your pupils. If your pupils are really large and they don't constrict, once again, it could be an adrenal gland problem. Cytozyme M is a neonatal product for men. Cytozyme M, I happen to take 4 every day. And the reason I do is it helps support my own endocrine system, my thyroid, my pituitary gland. It helps support my male hormonal system. Probably one of the most common body signals that I'm seeing right now of men over 40 that are passive, they're depressed, they're tired. You say, hey, let's go golfing. No, I don't want to do that. Hey, let's go for a bike ride. No, I don't want to do that. Hey, let's go out to have dinner. No, I think I'm just going to sit here and watch Dr. Bob and Dr. Anthony and Kaysen. Well, first, we enjoy you watching us, but you might need some Cytozyme M. Then you can have the power on. Cytozyme M, empty stomach, about 4 a day. De-stress. Hello, how many of you out there right now are stressed? Wave of hand, we could start a windstorm across the whole world right now. De-stress is a very popular product for all of you right now that are having stress issues. You might say, Dr. Bob, I'm watching you, and so I really want to get these products. You could go to one of our websites. You could go to druglessdoctor.com. It'll be on the screen, www.druglessdoctor.com. And you could purchase any one of these products. I know they'll make a difference in your life. But you know what? Always talk to your healthcare provider. If you don't have a healthcare provider, you can come and visit us at the Drugless Doctors website. And you can find out where exactly we're located, because you can come from anywhere in the world. We'll talk to you on the phone. We'll do consultations. We'll email with you. We will do what we can to help make a difference in your life. The next product that we're going to have is Cytozyme F. You got it. It's for females. You know, I've been so blessed. And by the way, I wrote a book, Dr. Bob's Drugless Guide to Balancing Female Hormones, Drugless Guide, by the way, and Dr. Bob's Men's Health, The Basics. Cytozyme F is for females, and I usually have our female patients take 4 to 6 every day. Do you have hot flashes? Are you depressed? Are you tired? Do you have tender breasts with your menstrual cycle? Those are common body signals of hormonal imbalance. I know you're exhausted. I've been practicing since 1978. We have literally touched thousands of ladies with our books and with Cytozyme F for female. It has adrenal, pituitary, it has endocrine products to help support your ovary function in your body. It is probably, besides PTH-PT and Cytozyme M, one of our most popular products that's available to our patients and worldwide audience. Cytozyme O, it stands for ovary. Ladies, cysts on the ovaries are quite common. We usually supplement with Iodozyme, which is a product we'll be talking about, and Cytozyme O. If you've been told that you've had a cyst on your ovary by your primary care physician or your specialist, before you make the decision to have it aspirated or have surgery, what do you have to lose? We see this in our practice all this time. Cytozyme O, 4 to 6 a day, with Iodozyme, cut back on soy, minimal exposure to bromine, fluorine, and chlorine. We have the ability with biocommunication to test for testosterone. Ladies, this is very important. If your testosterone level is high, when we do a female hormone saliva test, that's right, we do saliva testing to our patients and worldwide clients. If your testosterone is elevated, it commonly comes from a cyst on your ovary. Fe-zyme. Do you ever wonder where they come up with all these letters? Fe is for iron. We see so many individuals today that have iron deficient anemia. And do you know what one of the most common body signals and reasons for that to happen? You'll never believe it. It's antacids. It's proton pump inhibitors. What's that, Dr. Bob? It's Prilosec and those other medications that they advertise heavily on the TV all the time. Prilosec and these other proton pump inhibitors stop acid production in your body. If you are tired, I'm going to encourage you to have a CBC, that's Charlie Bravo Charlie, with a differential. We can literally send you a pack anywhere in the world that in the comfort of your own home, you could do a finger prick, then you could have a CBC with a differential. Maybe you don't have a healthcare provider and you'd like to have one. We do consultations worldwide. Fe-zyme. Fe-zyme will help your body and your body make red blood cells, which is going to give you that energy, because see, red blood cells carry oxygen. Right now we're going to take a short break and we'll be right back. Hello, this is Dr. Bob, Anthony, and Kason DeMaria, and we are going to continue on. I know so many of you have questions about what type of items that you should take for your chronic health problems. Well, today's the answer for you, and guess what? We're going to post this on the internet, and you could watch it over and over and over again and be just as smart as Dr. Bob, Dr. Anthony, and Dr. Kason. Now, this product that we're going to talk about, we have so many that are so important. This product is ADP. It's emulsified oregano. We use this for chronic fungus problems and people who have upper respiratory and have a history of parasites. And maybe you eat wild game or you've been to a third world country and even have a cat. You grind your teeth at night. You eat sushi. You love pork, or maybe you went on a missionary trip. Maybe you wake up at 1 or 2 o'clock in the morning. Maybe you went to your healthcare provider like we see happen to our practice all the time and they don't know what to do with you. ADP is a product that we generally will recommend if somebody has a high eosinophil count that's found on their blood serum or their blood CBC test. Oregano. Now this is a very aggressive product, and sometimes we'll recommend 5 3 times a day for a week, and then 3 times a day for a month. We had one woman that was exposed to just a lot of toxins, and she was at a third world country and she just wasn't feeling better. ADP brought her through. It's an awesome product. The next product is Calmagzyme. We always encourage Calmagzyme on an empty stomach. It's calcium with magnesium. Do you have leg cramps at night? Poison ivy? Poison ivy, that's right. Usually a lack of calcium. Do you have dry skin during the wintertime? Cold sores. Common body signals for a need for calcium. Always on an empty stomach. If you have difficulties falling to sleep at night, you're going to want to make sure you take 4 or 5 of these on an empty stomach. This is probably one of the most important products that we use. You say, Dr. Bob, you've already said that so many times. Well, this is the big kahuna, because I know ladies that are 50 years old and older right now, you have heart palpitations, you're constipated, you have leg cramps at night or during the daytime. Aqueous magnesium chloride, 2 teaspoons before you go to bed at night. I can tell you this very comfortably and very confidently. We've had so many people with blood pressure lower naturally. I am not telling you to go off of your blood pressure medication. That is not the purpose of this segment tonight. But I want you to know there's a natural drugless alternative, and so many of you right now have a magnesium deficiency. And if you want, kale. Kale's the new beef. Kale is a great source of magnesium. Any green food is a great source of magnesium. BioHPF. BioHPF, if you have chronic digestive distress, there's a bacteria called pylori bacterium that could infest your stomach. This also has a bentonite clay in it. This helps absorb toxins that are in your digestive system, and it helps promote healing of chronic stomach distress. Amino acid quicksorb. I know that most of you don't eat enough protein. You're tired and sluggish in the middle of the afternoon. This has the 8 or 9 essential amino acids, a squirt or 2 in the middle of the afternoon. This is really good for individuals that are participating in athletic endeavors. Amino acid quicksorb, a great way to get protein in your body. Bioemulsion. Ladies, have you lost your desire for intimacy? Are you having female hormone challenges? Bioemulsion, 4 drops 3 times a day, will increase your desire for intimacy. At the same time, it's probably one of the best sources of vitamin C. What we do with these drops is I put it directly right on my tongue. And one of the products that we use, and I want you to know that this product right here, I take 3 drops every day. It's Bio-D-Emulsion. It's liquid vitamin D. And if you live anywhere that there's no sunshine, especially during the wintertime, this is part of our 1-2 punch to help prevent the flu. Yes, Dr. Bob, vitamin D in the flu? Of course, because vitamin D helps calcium to be absorbed. And I just spoke a moment ago about Calmagzyme. See, viruses get in your body if you don't have enough calcium. Stress takes calcium out of the body, and so does sugar. But during the wintertime, from November to May, everybody with the sound of my voice right now should be taking 2 or 3 drops of this every day. The most scientific way to find out how much vitamin D is to have a blood serum test or a blood spot test done for your vitamin D3 levels. And for all of our brothers and sisters out there that have dark skin, you usually have a deficiency of vitamin D. It should be 40. I rarely see anybody with dark skin, unless they're supplementing their vitamin D, be above 20. You could have chronic bronchitis, MS, high blood pressure, and diabetes, all because of vitamin D. Probably one of the more important ones that we have. This is another one of our favorites. Now, this is another one that Dr. Bob takes every day. I take about 2 drops on my tongue. It's A-emulsion. Say, Dr. Bob, why do you take that for? It prevents viruses and bacteria from bothering my body. It stops ringing in the ears. It helps my skin. You know, this skin is getting closer to 60 than it is 55 years old. Well, A emulsion is a source of A, and A is important for the integrity of your skin and your liver. Bio 3GB. Say, Dr. Bob, what is that? Well, there's different kinds of B vitamins, and this particular B vitamin is a fat-soluble B vitamin. It has riboflavin in it. Riboflavin is vitamin B2. You may have cracks right here in the corner of your mouth. Those cracks are called chelosis or chelosis. You may feel your heart beating on your pillow at night. You may have high blood pressure, maybe even some depression. Bio 3GB will help slow your heart down, helps dilate blood vessels, and it'll help actually lower your blood pressure. Bio B100s. Do you cry easy? People who cry easily usually need B vitamins. The mosquitoes like you. Do you have sore muscles after exercise? Those are body signals of a need for B vitamins. Do you have raw nerves? Do you hear the quietest noise sounds explosive? Could you hear the motor on your refrigerator humming right now? You say, do people do that, Dr. Bob? Of course they do. Do you have this massive sense of smell? Bio B100s is the answer. I've had people take up to 6 to 9 a day. Beta TCP helps thin bile. How do you know if you have thick bile? Do you have a metal taste in your mouth? Have you had your gallbladder taken out? Beta TCP has an amino acid in it called taurine that also helps heart health. B6 phosphate. B6 phosphate is for individuals who have chronic carpal tunnel syndrome. We can test for B6 by looking at liver enzyme studies on your blood tests. Carpal tunnel syndrome, any inflammation in your body, if you have low liver enzymes, that's a body signal for vitamin B6. Tendinitis is also helped by B6 phosphate. This is cytosine LV, which is for liver. Probably one of the most common health challenges that we see in our practice are compromised liver function. Do you have markings right here on your face, on your left cheek? Do you have varicose veins and spider veins and hemorrhoids? Are your whites of your eyes yellow? Those are body signals that your liver is compromised. Do you have a large abdomen? Body signal for your liver being compromised. 3 or 4 a day. Aqueous zinc. Hello. I can tell you right now, 30% of the women in the United States have a zinc deficiency. We've seen that through research. Usually you have large pores on your face, white spots on your nails. You might have blood sugar stress, memory problems. This is the blood or zinc, this is the aqueous